I actually have faced a lot of extreme difficulties. I'm a registered specialist, gynecologist, and I'm South African. I've got an ID document which isn't false. It's got all my particulars on, and I want to show you, I want to produce as evidence something here that you can actually see that's confirmatory. We have practitioners' cards which we must actually always keep with us at all times, and that verifies identity, and they always recommend that the practitioner's card should have a photo so people can identify you. And this practitioner's card from the Health Professions Council, which is freely available on the website, clearly shows me on a photo. It shows my ID number, it shows my name. So there's a lot of incorrect facts in the media. First of all, saying that I'm a fake doctor. So they are claiming that I'm not even a doctor. The second thing they are claiming is that I'm not a gynecologist. So besides being a doctor, I'm not a doctor. I'm nowhere near being a specialist. I'm practicing under a false ID, as you said. Yet my ID is completely present there. My names are on, my ID number is on, my photo is on. Reporters are stating that they get the information from the HPCSA, but that's reckless reporting then, because the HPCSA has all this on the website, and everyone has a registration document with an ID card. So I'm getting defamed, and my patients are actually wondering if I'm really someone else. Now the reason this has started off is for the following, it's transpired from the following cycle of events. I'm a local South African. I was born and bred in Durban, and I studied at the University of KwaZulu-Natal. I finished my basic medical degree, and I went into hospital practice. And then after hospital practice and doing a bit of GP work, I decided to go and specialize as a gynecologist. I went up to, in 2008, I joined Sefako Makhato University, which is attached to an academic hospital. The academic hospital here is Dr. George Bukhari Hospital. So at this hospital, we have to rotate for a period of a minimum of 4 years, and in that time we have to do certain clinical work to attain the competency of a specialist. We have to do ward rounds, we have to consult patients, we have to do ultrasound scan, we have to do procedures, for example cesarean sections, hysterectomies, evacuations of wombs where people have got miscarriages. So in general, that's the type of things you do for 4 years. At the end of the 4 years, generally, or a bit before that, we as doctors that are training register to write an exam, and then we complete a dissertation in respect of some research protocol that we are studying at that point in time, and then this is all marked and we become doctors, specialist doctors. Now I completed all of my requirements in 2010. My exams were done, I passed the exams, then I proceeded to the next leg, which was the dissertation. The dissertation was sent to Bloemfontein for marking because it goes to external examiners. It was sent to Bloemfontein, it was sent to Wits, and it was sent, I think, to an examiner in Sefako Makhato University Hospital, which is Dr. George Bukhari Hospital. So it was sent to Professor Buchman, Professor Wessels, and Dr. Mashamba, and all three of them marked my dissertation, and after a few corrections that I asked, it was passed. Now what was left then in 2010 was just for my supervisor, who's the head of department, to actually sign me off as a specialist so I could go and practice. But what happened is that this supervisor didn't want me to go out and have a private practice. He wanted me to stay in hospital and be subservient to him. He also wanted certain favors which I don't want to discuss because I'm not into the habit of besmirching other people. He asked for certain things which were like personal favors, and I was not prepared to engage with him in that respect. We immediately became bad bloods, and he said to me he's not going to sign my certificate was done, and I received proof from the university that I was done, and I'll show you that proof. But what he didn't want to do was sign my documentation so I could register to go into private practice. I will hereby provide the proof where my training was done completed in 2010. It shows that my degree, my training as which is M.Med in Obs and Gynae, was completed in 2010. So he didn't sign me. The only way I could get my registration sorted out, and this is what the media hasn't taken from me or asked me to validate. What happened is that I had to take I found that it was dragging on for a year, and this man wasn't signing. I was working as a junior doctor, like a very low-scale doctor. I was doing all the normal things that a junior doctor's done. But I'm senior, I've finished my exams, and I should be actually now training junior doctors. So I felt that there was a big discrepancy. I proceeded to an attorney, and we went to the High Court. Immediately when I went to the High Court, the professor said to me, you are my subordinate, and what you're doing is terrible. I'm going to finish you off. He then phoned the Hawks and said, just to get the sequence right, I then left the state and I went to Brits Medical Clinic to practice as a GP because I didn't want to work in the same department when I'd finished all my studies. And obviously if I'm working with you and we are having bad blood, we're going to see each other in the passage, and there's going to be friction. So I decided I'm going to move out, work as a GP at the medical clinic, doing casualty work and other work that's suitable for me, and earn an income away from the hospital. So the professor then got the hawks on me to say that I'm practicing as a fake gynecologist. That's where the fake gynecology emanates. And then he also, at this stage, reported me to the HPCSA. And the other thing he did is he phoned and gave carte blanche an interview. That's in 2013. So carte blanche came, and they presented a picture of me in 2013 as a fake doctor and a fraudulent doctor. But if you look at the facts are totally wrong, because I had completed my degree in 2010 and I wasn't a fake doctor at all. So they didn't take my side of the story. They didn't ask for documents to validate. Like as I said, you can see some reporters, you have a courtesy of actually validating stuff. This reporter who reported on the Cape Times yesterday asked me the same questions, and I said to her, I'd like to validate my story. I'd give you written documents because people are getting this wrong and besmirching me. And she proceeded to actually write an article, not even taking heed of whatever I had to say, or not taking anything. But to get back to the picture, so I went to the High Court. We had a case that was heard after many years, almost 10 years, and my degree, the judge in the Pretoria High Court said that I was extremely poorly treated, and then he asked the university to award my degree. And my advocates that did that case then launched off a claim against the university immediately, and we're currently sitting at the center of that claim. And I'm going to actually prove that claim to show you where we are at that stage. On the 22nd of January, I just want to quickly summarize this. The plaintiff acting in person and defendant duly represented by officials entered into a written agreement whereof plaintiff was admitted, registered and enrolled as a student in the Department of Obstetrics and Gynae. The agreement consists of an academic registration form duly completed and read with the general rules. Copies of the registration forms and the rules and regulations are attached. The plaintiff was obliged to comply with the requirements described in terms of Rule SM 114 including but not limited to the submission of a research-based dissertation. So, pursuant to the plaintiff achieving a pass mark from 2 external examiners, the plaintiff's internal supervisor was required to complete a single report that reflected the views of all examiners within 3 weeks. The defendant breached agreement with the plaintiff, whereby the Professor Monokwana failed to complete the report, and that was for 9 years, mind you. And so the written agreement was breached, and the High Degrees Committee would have recommended that the degree be conferred, but it couldn't be conferred because the defendant hadn't done his necessary report, a single report combining all 3 of the past reports. So I've been unjustly treated, and that's a civil claim that's up. But the judgment that was presented by the court in compelling the university to actually give me my signatures for registration was very harsh on the university, because it said they were actually using the university as a tool. That's what they said. Now, all of this here shows you that I've been to a tough time. No one listens to the evidence. No one wants to look at it. Everyone is actually labeling me as a fake doctor, a fake gynecologist. Patients are thinking I'm not a doctor. And the general consensus out there is that this guy is a fraud or whatever. But if I am fraudulent, why isn't the police arresting me? The next question I want to say is, why is any person that practices as a professional without registration is practicing criminally? You can't sit here and treat a patient, and you are actually interviewing me in a private hospital. Patients just walked out before you could come in. I would be criminally charged and locked up. There's so much of bad publicity going out. I would be locked. But can people like Sipakazi, who says fake gynecologist on the headline and misrepresents information, can she actually motivate why patients are coming in and why I'm sitting here in a private hospital with all my qualifications evident? And the third question I was going to ask is, she's releasing, the media is out to actually blemish me and destroy me, because people don't understand that propaganda is bad. The community doesn't understand these things, and they don't look at documentary proof or whatever. So when articles like what she did, like reckless reporting, goes out, like the Cape Times, where she's putting a headline with fake doctor, and carte blanche comes in, doesn't verify the facts, and they introduce something as fake doctor, yet the documents are showing that, you know, in 2010 I finished my degree. That sort of information is seen as cast in stone by the community, because the community feels like, why would someone go out there blatantly and disseminate this information if it's not true? So despite that, you are talking to a community who doesn't want to listen to evidence. They feel that that's strong enough evidence if they buy the Cape Times or Carte Blanche and they look at these articles. Came in, I've got nothing to hide. My attitude, I was there with my wife, who's a specialist, a child specialist. She's a pediatrician, she's working upstairs. And we decided that we'll just go there and we'll work as normal, because we feel that, you know, if we are illegal, we're going to face the might of the law if we do something illegal. So we were there, and we're not going to hide away, because we feel that we should be there, do our community work. This COVID-19 has stressed out healthcare workers. There's not enough resources. We are dealing with a pandemic, as well as with sick and pregnant patients. And if I'm going to hide away because someone is malaligning me or blemishing me, it's not going to make the situation better. So we went there, but the community probably feels that they are saving the community by actually closing us down, because maybe that's what they said to me. They don't believe me. They believe what Carte Blanche and what the Cape Times states. So they are taking what they see in the media, they say, is what they believe, because documents, actually one of them said to me, documents can be faked, and they can't believe those documents. So I said, if a document is fake, the regulatory body would be aware of it. And why don't you check with them? They said, no, that's not them. They are just lay people. They listen to what they see on radio, TV, or YouTube, and then they have to follow up.
Are you also disputing the two patients that allegedly were operated? What they say?
There is a very difficult process there. First of all, if I don't want to talk specifically about patients, because I'll tell you the reason. I'll be committing an offense because the patient's things are confidential and I can't put it out in the media. I'll have to give it to the appropriate forum. But let's say I'm going to talk about me and you. Let's say I've got diabetes and I've got HIV and I contract COVID. I will probably die much faster than you who's healthy and who's contracted COVID. So these patients that are operated on were significantly advanced in cancer conditions, and they had a lot of comorbidities. And even I can vouch for the fact that even if I didn't operate on them, the family that brought them to me were clutching at straws and looking for a miracle at that point. So even if I didn't touch them, they would have probably demised at the same point. There were a lot of, I'm talking about factors that are related to that condition, which I won't go into, but you can obviously see from the articles that are done that there was obviously a lot of falsehood, because in this day and age we deliver babies. We don't allow family to come and look at the baby in theater because of COVID. That's one thing. The second thing is, if you don't allow someone to come and look at a baby, how can a patient be allowed to come in to look at a person getting operated and look at and see the operated person? That immediately becomes suspicious, because if I don't let you go and see your own baby, which is a normal, how would you be allowed to see someone having a cancer operation? Then the second thing is selling a house. That patient consulted me, and a week later we made an appointment for theater. I never pressurized the patient to pay any money or to sell a house, because if that patient sold a house to pay me, as she insinuates, that would make me special, because I could get someone's house marketed, sold, transferred, and pay out within a week. I will prove that the patient saw me and from my documentation, and it was only a week. The patient came from PE, contacted me from the website, and I saw the patient like on the first day. A week later we were going. There was no ways that patient could have sold the house. So that's certainly a lie. And then another significant thing is that patient presented to me with a different name, and now she's relating everyone in media that she's a Zainab Ibrahim. I would have known if she was a Muslim straight away when she saw me. So definitely there's things that are smacking of falsehood, yet creating media attention. And then the final thing I was going to say is as follows. If she felt that her mother was terminally ill, why would she want to actually have an operation for her mother? Because the thing is, the mother would be at risk the mother would be at risk of something bad. She mentions that she thought the mother was going for a laparoscope. Now she's a lay person. She doesn't know what's a laparoscope in its entirety, because a laparoscope is something that you pass as a camera and you visualize organs. You don't open a person up. You pass a camera through, and through the camera you actually visualize everything, and you may or may not operate through that camera. So she's talking about medical things. She's obviously felt that she's seen cancer in COVID-19 situations where people are prohibited from even entering hospitals and let alone theaters. She's talking about selling a house in a week. She's talking about laparoscopic evaluation. So obviously someone has coached her, and they are actually creating a sob story to make me even look worse, to make me look like a person who's actually trying to hound someone to sell houses. and to actually consult me only after a house has been sold. So it doesn't smack of something realistic, because if you put yourself in her picture, let's say you have 3 kids, and if let's say you were to consult a gynae, that means you'd have to buy and sell 3 houses to consult a gynecologist, which is ridiculous, because I mean, like, you don't even have to sell 1 house to consult a gynecologist, even 4 times or even 5 times to deliver a baby. So what she's saying there straight away smacks of suspicious motives, because she's harping on the house that she sold in a week. She's harping on the fact that she's actually come there and then I've operated like a week later, which confirms the fact that she only saw me for a week. She's harping on the fact that she went into theater to see cancer being operated. And she's also harping on the fact that this is a name, and yet she never presented that name to me. Her mother's name is Beauty Mama. So it's the first time I've seen this. So obviously there's a lot of malinformation going around.